Patients and employees of Scripps Healthcare are worried about the impacts of a cyber attack that took place more than a week ago.
There's still a lot of questions tonight about what happened. News 8's Elizabeth Sanchez spoke with a security expert who has some advice for patients.
Patients we spoke to say they're not being told a lot about what exactly happened regarding the Scripps cyber attack. They want to know what information was taken, and they say it can be really frustrating.
Cyber attacks are up. In fact, security expert Caleb Barlow says 66% of healthcare companies cannot meet the minimum security standard defined by the National Institute of Standards and Technology.
The problem here is we have an industry with a rapidly growing technical debt. And it's not that they're not investing in security. They are. They're just not investing fast enough to keep up with an ever-moving adversary.
A Health and Human Services report on healthcare security listed the vulnerabilities in hospitals. They named networks without tight controls, how records are disposed of, the use of personal devices, and working from home.
And often, too, you don't see multi-factor authentication in place. And many of us are familiar with that, where, you log in with a password, but then you also have to get a challenge and response on your phone.
That extra step can keep cyber criminals out of the network. Scripps Healthcare is saying very little about its security measures and only issued a written statement saying the network outage was caused by malware. But they haven't said how that happened. We have learned the cyber attack took all Scripps hospitals out of the emergency medical response system on May 2nd when a boat capsized off Point Loma. Scripps Memorial Hospital in La Jolla was the closest trauma center to the incident, yet patients were sent to other area hospitals. It's the kind of disruption cyber criminals want.
It's always unsettling when you hear that your security has been breached, because I don't know what information they have and how they might use it.
Lisa Kendall's daughter's appointment was canceled, and like so many others, she's forced to reschedule it. But the lack of information from Scripps is leaving many with questions.
I don't know what to do about it, other than just make sure that I'm following my credit monitoring apps and make sure that nobody's trying to get our information. But I feel helpless.
Now, the security expert that we spoke with says this has been happening again and again. He told us about a number of healthcare industries that this has happened to. He says it's a problem that the country is going to have to address. Elizabeth Sanchez, CBS 8 News.